What?
Hello, Mr. Thomas. My name is Nicole and I'll be your nurse today. Before we begin, may I obtain your consent to proceed with this video assessment?
Yeah, that's fine.
Okay, perfect. May I confirm your name and date of birth?
Greg Thomas, December 28th, 1986.
Perfect. And what brings you in today?
I'm just looking to get a physical.
Okay, no problem. May I confirm your allergies?
I don't have any.
Okay, no problem. Are you in pain today?
No pain? Nope.
Okay, any difficulty breathing?
Nope.
Okay, as I'm seeing that there's normal chest rise and fall and you're not having any difficulty breathing, I do see that the medical assistant already obtained your vital signs.
Yep.
I am going to check your pulse rate.
Okay.
Prior to that, do you know what day it is today?
It is February 21st, 2025.
And do you know where you are at this moment?
Yes. We are in our home clinic.
Okay. And who is the president?
Donald Trump.
Okay, no problem. So I'm going to go ahead and assess your rate, your heart rate, if you don't mind. So thank you very much. So I got 43 and I listened for 30 seconds, so that is 86, which is within normal limits, okay? I was looking in my records, I do see that your vital signs were also normal. Your blood pressure was 120/82, which is almost perfect. And if you don't mind, I'm gonna give you this paper to read over, okay? What I'm assessing is his respirations. Thank you so much. In this time span, your respiratory rate was within normal limits, okay? Your heart rate as well. Your vital signs essentially consist of your heart rate, your blood pressure, your respirations, and I did also see that your temperature was also within normal limits too, okay? And so I'm gonna go ahead with your permission and start my assessment, okay? I'll start at your head and kind of work my way down over to your skin, as well as respirations as well. That's what we'll be covering today.
Sounds
okay. So first and foremost, I'm going to go ahead with your permission to assess your skull. I'm assessing for any masses or any abnormalities. Okay, perfect. Have you noticed any hair loss or any increased hair growth?
No.
Okay, no problem. And I'm going to go ahead and proceed, and I see here that I'm visualizing in your face that your eyebrows are with the hair within your eyebrows are within equal distribution. And do you mind removing your glasses for me? Thank you. The eyelashes as well have equal distribution. I don't see any hair loss, and I'm going to go ahead and assess your eyes, okay, if you don't mind. So I'll be shining the light from the side going in on both sides, and that essentially is assessing the reactivity to light, and I'm assessing different aspects as far as pupil size, reaction to light, and whether your pupils are round, equal in size, etc. All right, so this is go, okay. All right, now the other side, okay, perfect. And so you're going to focus on this pen, okay, and far away. All right. So the pupils, by what I observed, they're equal, reactive, round, and your conjunctiva, if you don't mind pulling down your, okay, so, yep, all right. And so the sclera is white, and the mucous membranes in the conjunctiva, sorry, my apologies, is also within normal limits. Have you noticed any increased tearing or any discharge in your eyes?
No.
Okay, no problem. And so I do see that you wear glasses. Have you had any other trouble with your eyes?
No.
Okay, no problem. So with your permission, I'm going to go ahead and palpate your sinuses here. Okay. Any pain?
No.
Okay, no problem. And so I'm going to go ahead and proceed to evaluate your nose, okay? Prior to that, have you had any nasal surgery or any
No.
nasal polyps?
Not that I know of.
Any issues? Okay.
Nope.
No trouble breathing, or do you have any trouble breathing?
Nope.
Okay, no problem. All right. Okay. So what we see, there's no deviated septum. There isn't any abnormalities that I found upon my assessment. I do see here that I'm going to go ahead and assess your oral cavity. So if you don't mind, opening your mouth. Thank you. All right. The uvula is midline. The tongue is symmetrical and pink and moist. All right. Do you have any trouble chewing, or do you have any dental implants, crowns?
No.
Okay, perfect. All right, no problem. So I'm going to go ahead and assess then the lymph nodes, okay? So I'm going to step behind you and I'm going to go ahead and assess these here. So I'm going to start with the periocular, which is right in front of your ear, okay? The post-auricular, periauricular. The post-auricular are right behind your ear. The occipital is right behind the neck. Okay. The subclavicular is right here. Excuse me, sir. I'm so sorry. I'm going to go ahead and move these here. Thank you. Subclavicular is right here at the clavicle line. The submandibular are right here at the mandible area. Okay. And the thyroid is right here. Do you mind swallowing for me? Okay, no problem. So that's where we would assess that. I didn't observe any palpable lymph nodes, which is a good sign, okay? If there was any swelling, then we would further evaluate that area for any other abnormalities, okay? I am also going to check your ears, okay? And so, do you have any pain right here? Okay, any pain?
No.
Okay, so typically at the tragus is where we apply just a little bit of pressure, and if there is pain noted there, then there's something going on, okay? I'm going to shine my pen light in your ear canal. Okay, all right. The ear canal, excuse me, sir. Okay, all right, no problem. The ear canals are clear. I don't see any indication of any wax or anything, which is good. Do you have any problems hearing?
No.
Okay, perfect. All right, no problem. So next, I'm going to go ahead and assess your skin, okay? Do you mind holding my hands? Can you squeeze them? Okay, all right. And can you push towards me? All right, and then push against. Perfect. So I'm also assessing the cranial nerves in that aspect as well, okay? And I'm checking your skin. All right. So here I'm assessing the turgor, the skin turgor, and the skin is smooth and firm. If there was any indication of tenting, then it may be a sign of dehydration, okay? But I see the skin is smooth and firm, and I'm going to check your hands here, and I'm assessing for capillary refill, which capillary refill is present, okay? And I see your skin is not dry, or do you have any history of any moles, or have you noticed any skin changes?
No, I haven't.
Okay, no problem. So typically we would look for that as far as any changes in mole size, the diameter, the size, the color, and just kind of keeping an eye on your skin for any changes. Very important.
Okay.
Okay. Next, I'm going to go ahead and check and assess your respirations. Okay. My stethoscope is clean. Okay, just cleaned it. But I'm going to warm it up because I am going to be listening to your lungs. Okay. Okay. All right. So essentially, for the lung sounds, or assessing bronchial, which is in the trachea, the bronchiovesicular, which I like to remember them that it's more or less along the sternum, and the I'm so sorry that I'm touching you. I just want to kind of show. And so the vesicular are out in the intercostal areas as well. Okay, so I'll be listening to your lungs anteriorly, which is in the front, and posteriorly in the back.
Sounds good.
Thank you. Any trouble breathing?
Yep.
Any history of asthma or any respiratory conditions?
No, ma'am.
Okay, perfect. You can breathe normally. I'm so sorry. Do you mind unbuttoning that? I'd like to hear a little bit clearer. Thank you so much. Okay, with your permission, I'm going to go ahead and put it in, okay? Thank you. Much better. Replacement. All right, now I'm going to go ahead and listen on your side. So if you don't mind, yep, thank you. Yeah, I'm going to, do you mind lifting up your shirt? Thank you. Take a deep breath for me, please. Perfect. Okay. Now, if you don't mind bringing the chair, thank you so much. There we go. Deep breath. Okay. Okay. Now I'm going to go ahead and assess posteriorly, so if you don't mind kind of...
You just sit forward or?
Sure, I'd love for everybody else to see as well. That would be great. Perfect. Thank you so much. All right, I'm going to move your hair. Okay, deep breath for me. Okay, you could breathe normally. Okay, and another deep breath, please. Okay. All right. Well, your lungs sound clear in all upper and lower lobes, anteriorly and posteriorly. What we're looking for is adventitious lung sounds, which would be abnormal lung sounds. And this would be wheezing, rhonchi, crackles. Typically that would be abnormal for us to find, okay, upon lung auscultation. I am going to check also the fremitus, okay, and so what it is, so if you don't mind turning around again, sorry, and so what you're going to say and repeat is the word 99, okay? And so what I'm feeling, or what I'm trying to feel, is vibrations of you saying 99 all the way kind of down, okay? So go ahead.
99.
Okay.
99.
Okay.
99. 99.
Okay.
99.
Okay. So it was, I heard and felt the vibrations all throughout that assessment, so that is a normal finding, okay? And so I believe we've covered everything. Is there any other questions that you have for me?
No, thank you.
Okay, perfect. So we'll complete a thorough assessment at a different time. This is including the cardiac cycle and the cardiac function, as well as the abdominal assessment too, and peripherally and the cranial nerves in depth as well. But thank you again for your time, and we'll speak soon.
No problem, thank you.
Thank you so much.